soy in any form. Most of the soy in this country is converted to hydrogenated soybean oil for the entire world, right? In addition to that, what percentage of soybeans grown in the United States is genetically modified? All of it, correct. That's why a lot of countries in Europe will not import it. I'm sorry, coffee has no nutrient value as well. So for 60 days, we've had enough of sympathetic dominance. We're going to give it a break for a while. So obviously other clogging foods, the cathedrals of death, you have to avoid them completely. You can actually have pizza if you make it yourself from all healthy ingredients. That's a whole other lecture. So obviously, we are addicted to the things that poison us. I've worked with a lot of cancer patients. Some of them, I'm lucky enough to get them at the beginning. I do the live cell test. I do the intake. I have a complete questionnaire, a medical history. If I get them before they're on chemotherapy, they stand a much better chance of recovering faster, right? But you know, I have blood tests of some of these people who are under chemotherapy. Their blood looks like STP motor oil. It doesn't even resemble anything human, you know? And then you give them the enzyme and the antioxidant, and the after test begins to look normal. In 30 minutes, it's amazing. But the point is, I learned this a long time ago. You can't take responsibility for anyone's health except your own. Even though you see that they're killing themselves, here's what I learned, this dark truth. Many people, especially those who have a terminal disease, when faced with a choice between lifestyle alteration and death, will choose death. Right. Unfortunately, that's true. So even, you know, people call me all the time wanting to do a detox program, wanting me to save their family member. They know the whole story. They see the future. People with cancer, the majority of people with cancer do not die from cancer. They die from cancer treatment. My contention is that if you are still breathing, you can recover from virtually anything. Cancer patients choose to keep smoking. Who knows who Warren Zevon is? Yeah, Werewolves of London. I saw Lon Chaney at Trader Vic's and his hair was perfect. Remember that? Come on. Yeah. Anyways, he was from Santa Cruz, or no, I saw him in Santa Cruz, right? Anyways, he was a rocker in the 90s, right? Anyway, so he got cancer, he got lung cancer, chain smoker, right? He got lung cancer, and they go, well, Warren, we're sorry, but you have terminal lung cancer, and you only have 6 months to live. And he goes, that's okay. He kept on smoking, and because he said, I wanted to finish my album, and he actually lived another 2 years. So I guess somebody could come along and say that cigarettes are 4 times as effective as chemotherapy because because the doctor told him if he took chemotherapy, he would be dead in 6 months. Now, this is the most amazing sales job I ever hear. They do this every day, and they pressure people, and they say, I'm sorry, you know, they give the Wagnerian pronouncement, oh, I'm sorry, but you have pancreatic cancer and you're going to be dead in 4 months. Now, what we can do for you is we have chemotherapy, we have radiation. Now, they're not going to cure you. They're not going to extend your life. You're going to live the rest of your days in excruciating pain. Your hair is going to fall out. You're going to look like a living cadaver, but that's the best we can do, and we recommend that, and the majority of people, they do it. That is salesmanship. Those guys are good.
They don't know that according to the best medical literature, doing nothing at all increases one's chances for longevity better than any standard cancer treatment. And Warren Zevon was just a typical example of that.
So diabetics will keep eating root beer floats. Okay, Mrs. Gargantua, your feet are about to fall off. You have a choice between correcting your lifestyle and your feet falling off. That includes your daily 3 root beer floats. So 50-50 for that one. 50-50. Obesity is something that is self-perpetuating. It's more of a psychological thing. The numbers for obesity, when you look it up with CDC and NIH, you get various figures. I think you have a more accurate idea of the real figures of obesity when you take a Carnival cruise. You have more insight into obesity proportions in the United States than they do. But it's more like food is their reason for being. It's the most important thing in their life, and so you really can't expect these people to give that up. They would prefer no life to life without their comfort foods. This is an actual fact. Here are the top 10 causes of death in the United States today. This is right out of the CDC. So accidents is about the only one that is not direct. I'm not saying influence, not just influence. It is caused by your lifestyle, right? Parenthetically, I want to mention this. This is marketing and salesmanship most sophisticated. You see this influenza and pneumonia? Why are those have been together for the last 35 years in the CDC's epidemiology. Why? That's to sell the flu shot. Right? So people with pneumonia, they become so immune suppressed at the very end of their life, they get the flu. And so that chalks up the numbers of people who die from the flu and make it a very dangerous disease. So I have a whole section on how influenza became added to the mandated schedule in 2006 in your textbook, Vaccination is Not Immunization. But anyway, the choices we make, our lifestyle, the food we eat, the people we associate, how often we get adjusted, what exercise we do, where we live, all of these are things that can correct virtually any physical imbalance, no matter how bad. In my experience, in Dr. Bergman's experience for sure, we've seen so many people who have been pronounced terminal cases recover, primarily because somebody told them they could. I thought I was supposed to be dead. You're telling me that I can survive? Nobody tells them they can.
And then they die on cue like a good patient should.
We talked about reflux esophagitis. According to the New England Journal of Medicine and a more recent study, you know what that is. The stomach juices back up. We have no enzymes. We eat all foods that are dead and they're all processed. We can't break them down, and they just sit, these foods just sit in the stomach month after month. And when you lie down at night, it comes up, or you start eating and you don't have much of an appetite because you already feel full. Well, that's because you already are full, okay? So this is the first and most important part of the 60-day program. An enzyme, for the first time in their life, they're going to be doing
9 capsules of enzymes
every single day, 3, 3, and 3, morning, noon, and night. And the first thing that's going to do, it's going to introduce into the stomach the enzymes that have been removed by food processing for the first time. And the good news is that it doesn't take 60 days to cure reflux esophagitis. It only takes a couple weeks. Even though they've been on Prilosec, what's the other drugs that they use for that? What does Prilosec really do? It turns off the production of your body's own digestive enzymes. Oh, that's heartburn. I can't stand all that pain. Well, I got an idea. Let's turn off the only means that you have of breaking that food down and digesting it. Yeah, then you won't have all that hydrochloric acid and enzymes in your stomach, but guess what? The food is just going to remain there. So we have covered up the problem. That's the medical philosophy. Cover up the symptoms, just like the old thing that BJ used to say. You know, you're driving your car and the red oil light comes on and you take a piece of duct tape and you put it over the oil light. That's what medicine is, right? I can't take credit for that, give that to BJ. Heartburn has nothing to do with the heart. That is the sensitive, delicate mucosa being inflamed by the body's valiant effort to attempt to produce more and more digestive juices in the vain attempt to metabolize the processed food that you keep shoving down your throat. Not you, though. The generic you. Who knows what Barrett's syndrome is? Barrett's syndrome didn't just happen, last week. Barrett's syndrome is when the distal part of the esophagus near the cardiac sphincter, where the esophagus goes into the stomach, because of all the outpouring of digestive juices month after month, the delicate sensitive mucosal lining, it degenerates and becomes scar tissue. And then after another few months or years perhaps, the scar tissue, it becomes metaplastic, it becomes cancerous. That's the pathophysiology of esophageal cancer, which is one of the top 10 cancers of the United States. So my point is, every single one of these people diagnosed with Barrett's syndrome has a history of reflux. So it makes perfect sense. It's so logical, the sequence of events that happens.